I welcome all of you, and I'm extremely grateful to all of you that despite venue change, you have been able to come here and make this CME a success. I would introduce Dr. Sahu. He has given me only 3 lines of introduction. He is MD Internal Medicine, DM Endocrinology. He has been practicing in GK1 and he is associated with 2 hospitals, Cmes and Institute of Liver and Biliary Sciences. So without any further delay, I would request Dr. Monashis Sahu sir to take us through this very important lecture on medical nutrition therapy, and I hope Dr. Sen Gupta will take over and wind up the CME when he comes. So thank you again. There are 2 things that I want to tell you. This CME is accredited by DMC for 1 hour and 45 minutes of credit hours. Secondly, kindly sign your attendance in the register. Don't forget that. Once again, thank you all of you.
Yeah. So, talking about a medical nutrition therapy, let me be honest, it is exceptionally confusing. It's like you can eat anything as long as you're happy, and that's the best part of the nutrition. Exceptionally confusing because there's a lot of controversies. You say limit your fat, limit your saturated fat, another group will say there is no problem of saturated fat, no linking with the cardiovascular diseases. So and there's so much of controversy. So what I'll be going through is, hopefully, beyond the slides, if possible, would love to interact with all of you. Give my perspectives into just the macronutrient, the carbohydrate, the protein and the fat, and leave all judgment decisions on the. We are here to talk about a medical nutrition therapy which by itself has got a definition and by itself has got some meaningful interpretation rather than just a terminology of a nutrition. Nutrition means everything, but when it is a medical nutrition therapy, one has to talk about that how much, except what is showing is that if there is anything in context to BMI and to the risk of anything else, there's actually more risk towards a type 2 diabetes mellitus rather than even a coronary heart disease. So there is a context to even a management of type 2 diabetes mellitus when you're deciding about the nutrition in context of the patient. Quick questions. How much of weight loss is needed if there's a kind of an impaired glucose tolerance to come back to the normal glucose tolerance, or if there's a kind of an initial onset of type 2 diabetes mellitus? So what percentage, or is there an absolute number?
At least 10%.
Yes. 5%. So at least a kind of a 5 kg by nomenclature, I mean in terms of that quantification or in terms of percentage 10%. How much of percentage needs to be reduced if one needs to reverse, if not reverse, impact a non-alcoholic steatohepatitis? Close to 40%. Yeah. It's unimaginable, but that is what is needed. The next part of the story is that whenever we're talking about a weight, a normal BMI is so ideal for everyone. The fact is, the weight loss is the only thing which has been proven. If we talk about the diabetes prevention program, etc., when there was a weight loss in association with the lifestyle, and that is the intensive lifestyle measure, that far superseded in context of the ability to reduce the incidence of type 2 diabetes mellitus as compared to even metformin. So all we're trying to help understand the fact is, let there be no debate in terms of the utility of a medical nutrition. If you're talking about clinical trial, there was a medical nutrition which was devised for that. It's not that जो 2 मिनट में बैठ करके हम लोग बोल देते हैं कि ये खा लो वो खा लो. That's not a medical nutrition therapy. It's called as a nutrition advice, but when you're talking about a medical nutrition therapy, you really have to quantify कि इतना calories आपके लिए जरूरी है. Of that calories, we want to divide this much of 1/3 of calories around the breakfast, or something around 1/3 into lunch and 1/3 into dinner, and something like a low calorie food between the snacks between breakfast to lunch and lunch to dinner. So no controversies. Diet is the most important one. Some quotations: let food be your medicine. That's the most important one. I mean, the fact is that one cannot negate, one should not be debating on the fact, and food is such an important aspect when we are talking in context of type 2 diabetes. So what is MNT? Back to the question. The fact is, it is a nutrition as a therapy which is devised for the individual patient. As simple as it. It's an English nomenclature, you have to segregate it. So it's a medically devise nutrition as a therapy for the particular patient. If it is type 2 diabetes mellitus, there's some set of guidelines. If it is type 2 diabetes mellitus with a chronic kidney disease, there's a set of guidelines. In other words, there is actually a role of a registered nutritionist. How many are nutritionists among here, if there is any? Oh, so we all are healthcare practitioners. We all are practically all. The fact is, again, no debates about a MNT, if I can start using this short term. The MNT has actually been shown in various trials as an ability to reduce HbA1c by at least 1%. Correlate with that with other therapeutic indications. Insulin, it can reduce the HbA1c by around 1.5%. You talk about sulfonylurea close to around 1 to 1.5%. Talk about a new generation oral therapies close to approximately 0.5 to 1%. But across all the major trials, when an MNT was devised into those as an added therapy, so this is a therapy, nutrition is a therapy. So if that was put on in context to what the oral hypoglycemic agents or even an insulin was, there was an additive at least 0.5% to as much as approximately around 2%, depending on clinical trials and how early they were started on. So the whole crux of the matter is, let all of us acknowledge the fact that there is a need to even send our patients to the dietitians in terms of, I'm so sorry that I'm not doing it nowadays. I remember at least during our DM days where we were told कि दवा लिखने से पहले इतना लिखो कि calories कितना खाना है. So we used to actually say कि हाँ ठीक है 20 kilocalorie per kg करने के लिए एकदम obese के लिए, or do you want to give it to approximately 35 kilocalories per kg. That's something which we have left that kind of a practice. I guess it's more to that 2 to 5 minutes of a consultation, but that's something which is so critical and so important. Okay. The fact is, ADA recommends medical nutrition therapy as an effective component. The goal of MNT is to ensure that the spike of the glucose is not to that heavy extent. To give you an example, just talk about an individual who misses a breakfast and straight away goes to the lunch. And in the lunch bus, वही हो गया कि canteen में जाकर के 3 रोटी खा रहा है, and you know how the rotis are made in the canteen. So there will be a spike of the glucose. So the role of the medical nutrition therapy in context of type 2 diabetes mellitus is, at least the first denominator is that avoid that spike of the postprandial glucose, however you want to use it. You want to use a multigrain atta, use it. You want to add a lot of vegetables to the rotis and decrease the glycemic index. I hope you all are aware. I'm not really getting into all those nitty-gritty basics of glycemic index. We are aware about it. It is helpful. Then one needs to understand, even as a context of the MNT medical nutrition therapy, if there's a dyslipidemia. So the overall fat that is getting into the food, is this more of a monounsaturated fatty acid or a complete saturated fatty acid? To give you a context, fat, good or bad, let's debate about it. But the fact is, there is no debate that trans fat is bad, right? There is no debate that a monounsaturated fatty acid, something that you get in walnuts, akhrout, is actually good. There are no debates around it. So the medical nutrition therapy has to get into those perspectives, understand which oils to be used, etc. To talk about the salt, overall salt intake, not to move beyond half a teaspoon for a particular patient. And of course to address the individual nutritional needs, like if there is a CKD or a liver diseases, what etc. to be done. Are there any recommendations? I know this is boring because all we need to understand for all of us and each other is that we are not talking here about it just as a nutritional as a science. When nutrition as a science होगा तो हम बात करेंगे legumes कैसे खाना है, beans कैसे खाना है, कितना घी मक्खन डालना है वगैरह वगैरह. We are talking about what is MNT. So please understand that MNT is a terminology by itself and it is a therapeutic option by itself. So everybody is talking about a medical nutrition therapy. Are there guidelines? Yes, there are many guidelines, and just talking about some bullet points from the Canadian Association. That is important. It is important for the counseling to be done by a registered dietitian. The fact is, divide into percentages of macronutrients. The carbohydrates should not surpass more than at least around 55% or so. Protein should be around 20% and fat should be around 1/3 of it. And no more than 7% should come from the saturated fats. I can take up as many questions as possible, but just allow me to enumerate everything. And the added sucrose or the added fructose in the diet should not be more than 10%. We're not talking about the fructose from the fruit-based diet. And we'll talk about the so-called WhatsApp videos where everybody says that fructose is so good and it does not impact the diabetes. That's so controversial about it. Okay, a bit of a philosophy that as we constantly are evolving, our lifestyle is changing and our nutrition is getting skewed, isn't it? So the best thing is, if somebody talks about what is the best nutrition, kaise khana hai, you go as much to the left of the slide and say that hunting and gathering was actually the best kind of a nutrition. I mean, is there a debate? I really don't know. The more the processed food has come, just because of our sedentary habit, ki packet kholo aur khao, that is where the entire disease spectrum has come up. So how do we do it? MNT theek hai. I mean, for everything we cannot just keep on talking to the patient for half an hour. It is impossible from our Indian-based practice. So quick that 2-3 minutes of interaction with our patient, what we as practitioners can actually tell it to our patient. The fact is that whatever we say, it has to be efficient so that patient samjhe. It actually has to be easy for all of us to tell them कि हाँ इतना कर लो, some simple things. And ideally it has to be error-free. ये नहीं कि आज हम बता रहे कि हाँ ये तेल खा लो और 1 महीने के बाद बता रहे वो दूसरा तेल खा लो. So the patient will get confused and that is where the irritation comes. So what do we mean? We are talking about, so just giving you some template for that kind of a 2 minutes of consultation of the patient is that एक प्लेट अगर है तो उसमें कितना कार्बोहाइड्रेट होना चाहिए, कितना प्रोटीन होना चाहिए, कितना फैट होना चाहिए, right? The carbohydrate should not cross more than 60%. 60% is the upper limit. Actually, there are some group of bodies who say it's just limited to around 45 to 50%. Which means half of the plate अगर cross कर रहा है with the chawal, the Bengali chawal, mache chol and bhat wala, or a kind of a completely 3 roti, which is a half a plate. 1 roti is 1 serving, right? अगर पूरा plate के हिसाब से बात करेंगे, पूरा roti और chawal के लिए, that is actually more than 50%. We are definitely wrong out there, and let us be honest about it. जितना हम लोग अपने ऊपर करते हैं हाँ कार्बोहाइड्रेट खराब है, but when we see it in context of the patient, they're actually still having more than 50-60% of the food of the calorie as a carbohydrate. So this has been evidence from the Indian studies that is the major food sources is actually kind of a defined carbohydrates. And this was close to 65%. So there are data across pan-India which has been taken from north, south, east, west. And this is where the first is कि डॉक्टर साहब खाना क्या है. सबसे पहले हमें बोलना कि प्लीज प्लेट का आधा से भी आधा होता उसी पे लिमिट करो कार्बोहाइड्रेट को टोटली. If you talk about a kind of a carbohydrate serving, I mean again these slides are not talking about carbohydrate counting and everything, but a quick thing which you can tell the patient कि please एक चीज उठा के तो उसको एक सर्विंग मानो. जैसे कि 1 ब्रेड हो गया तो वो एक सर्विंग हो गया. Don't cross at least between more than 2 to 3 servings per plate. So 2 ब्रेड से ज्यादा नहीं. रोटी का सर्विंग हो गया है, so रोटी का सर्विंग अगर इतना कप का आधा का अगर आटा से बना हुआ, that is 1 serving of a roti. So don't cross a kind of a 2 servings of a roti at a time. So too confusing and irritating, but the first MNT in our 2 minutes of a consultation with the patient starts with discussion about a carbohydrate. And even in context of the carbohydrate, I'm sorry, this is like an impromptu because nutrition you're allowed to speak anything and you can also debate with me. The fact is, don't look at only the carbohydrate, protein and the fat. I mean the body says, the entire body of evidence says it is so confusing because the food changes the behavior क्योंकि वो प्रोटीन के साथ फैट भी मिक्स हो रहा है, फैट के साथ कार्बोहाइड्रेट भी मिक्स कर रहा है. To tell you an example, a person अगर रोटी केवल खा रहा है तो उसका glycemic index थोड़ा सा फास्ट होगा, right? You add a little bit of fat into it, fat delays the gastric absorption. So therefore, the glycemic index of that roti, which is associated with a bit of a fat, would actually go on a kind of a slower absorption. Does that really tell us कि हमारे forefathers जो लेते थे कि a bit of a kind of a roti with a bit of a ghee, is it really good? I really don't know. No one has an answer to that. But if you think about that from a hypothetical perspective, a little bit of a fat there is actually all right. Let's not really make it a kind of a devil around it. Okay. Back to MNT because we are talking about MNT. I mean, we cannot say कि मैंने ये देखा है, मेरे दादाजी ने बोला तो ऐसे करेंगे. But the MNT is that first is start with the calorie requirement. And there are kind of there are tabulations how to calculate the calorie requirement, but just a kind of a quick thing about a 20, 30, 40 wala. Overweight है तो 20 kilocalories per kg per day. Underweight है तो roughly around 40 kilocalories per day. And this is not the wholesome truth. The truth is that when the dietitian sits with them, they will actually take into consideration कि sedentary है कि नहीं है, overactive है कि नहीं है, or is it like a kind of a manual laborer. For everything like a manual laborer, they would actually add something like somewhere between 5 to 10 kilocalories per kg to the existing tabulation. So the first thing is just calculate the calories. Can we really do that? Yes, maybe at some point of time, if it is only carbohydrate counting as a topic, would be very happy to come with my dietitian and talk about it. So sir, you can take this as a next topic. Okay, but why are we actually measuring the calories and everything? Because ultimate goal kya hai? Is a weight maintenance or a weight reduction, right? I'm so sorry, I'm going very, very fast. The fact is that if a person has been close to a healthy weight, amino acid does that protein contain. As I was saying, egg is 1, the whey protein is 1, the soy protein is roughly around 1. So these are like high grade protein. And in context, again with conflict of interest to the pro hands D, one needs to understand that in any nutritional supplement, अच्छा डॉक्टर साहब हमको प्रोटीन पाउडर लिख दीजिए, वो अभी भी वही पुराना का प्रोटीन एक्स चल रहा है, which is okay. But you have to really analyze whatever you're writing as a therapeutic perspective of a powder or a nutritional supplement. Which are the key protein? Is it containing a whey protein or a kind of a casein, which is again a milk protein, or a soy protein with isoflavone? So these are really important high biological availability and a high PDSS of a protein. If you again want to take a kind of just a snapshot of thing, that कि हमारे Indian food item में कहाँ कितना protein है, I mean egg one medium size is 6 grams. So if you take an egg, do you think so quick question is अंडा को अगर हम बॉईल करके खा रहे हैं और केवल व्हाइट एग हम खा रहे हैं, व्हाइट पोर्शन ऑफ द एग, डू यू गेट ऑल द प्रोटीन आउट देयर? द आंसर इज नो. देयर इज आल्सो प्रोटीन इन द एग yolk, right? And to what I remember, one can cross question me once again, just correct me. I believe it is something like close to approximately around 25 to 30% which is in the egg yolk as a part of the PDCAS protein. So it's not that egg yolk is only fat, it also contains some protein part of it as well. Okay, now from a protein we come over to fiber. So we touched upon a carbohydrate, we touched upon a fat where the ratio of MUFA to MUFA has to be exceptionally beneficial to a protein. How about a fiber? And fiber हम कितना खाते हैं अपने regular diet में? I mean, unless you're eating salads, unless you're eating some rajma, sprouted beans and all those, otherwise the fiber content is very poor. Is fiber needed? The answer is a big yes. Now, fiber हम लोगों बस एनालॉजी में हम लोग केवल ये बोलते हैं कि फाइबर मींस कि कॉन्स्टिपेशन नहीं होगा, राइट? बट फाइबर हैज गॉट अ मेडिकल थेरेप्यूटिक एस्पेक्ट आल्सो. So this fiber which is a soluble fiber and this fiber which is an insoluble fiber, right? In terms of soluble fiber means एक gum type का बन जाता है पेट में, and in terms of insoluble fiber, the same fiber would be just getting into the colon, possibly slightly getting fermented out or just passes as a fecal stool. In terms of the soluble fiber, most of the plant-derived fibers, or even for that matter, जैसे एप्पल का जो पेक्टिन वगैरह जो होता है, these are like soluble fiber. वो जाकर के पेट में थोड़ा सा फूल जाते हैं. It also gives a promotion of a satiety. Is it important? It's so important for a type 2 diabetes mellitus when you're managing as an overweight. वो थोड़ा सा खा लेगा, जरा सा फाइबर जाएगा, तो एक satiety वाला feeling उसको जल्दी आता है. So soluble fiber is really important from an early satiety. Why it is important? Because जब हम बैठेंगे और हम GLP के ऊपर बात करेंगे, it promotes an early satiety. We also need to be aware that one of the medical functionality of a soluble fiber is a kind of a reasonable satiety. The second part of the story about a soluble fiber is that, you know, what happens is that it blocks the cholesterol absorption sometimes. Now, once the cholesterol is, the absorption of the cholesterol, all the bile acids is actually slightly curtailed. Typically, the liver will again manufacture a bit of more bile, which how it will manufacture? It will manufacture from taking out the cholesterol from the blood. So cholesterol to bile synthesis jo hota. So essentially, there is also a reduction of a dyslipidemia or a kind of an improvement in dyslipidemia by enhancement of a soft fiber in the diet. Usually we get all those soft fibers again from the dal ka chilka or from the legumes, from rajmas, and funnily again with conflict of interest for those products which is there, Pro-Ans D, and for many other nutrition supplements which you need to understand which is the kind of fiber. To give you an example of a Pro-Ans D, they contain those fibers जो कि एक acacia which is a kind of a gum related soft fiber है. So this is a plant-derived soft fiber which is also added to some nutritional supplements intelligently. And once a nutrition supplement is actually designed that way, there's an early satiety and there's a kind of calories which one can really measure it appropriately. So it can lead to kind of a graded weight loss. Quickly, how much of fiber is needed? It's close to approximately 1,000 calories per around 10 grams. So we say approximately around 30 grams per day. अगर फ्रूट्स नहीं खाना है, वेजिटेबल्स नहीं खाना है, उसके एक से होता है. So generally, 1 tablespoon of wheat bran, it contains roughly around 1.6 grams. So you can understand the kind of fiber that one is needed. What is 1 tablespoon, by the way? Just again a dietary jump, बोलते हैं 1 चम्मच. Yes. So how do we tell the patients in a quick way? We say कि 1 चम्मच is an equivalent to the thumb, and 1 tablespoon is an equivalent of a regular akrout. So that is the volume of a teaspoon and a tablespoon. So this is like again. So when I actually talk, always please, I mean, excuse me. I always think about what is that 1 minute में हम patient को बता सकते हैं. This is again something about sources of fiber. It is a long list. But what you need to understand is about the beans, the lima beans, the lentils, the dal. इसी में सबसे ज़्यादा फाइबर होते हैं. Rest जैसे एप्पल हम खाते हैं, the common things. आजकल हम लोग जब एप्पल मिलता है, तो क्या मिलता है घर में? हम छिलका उतार देते हैं because we think that the apple का wax skin है. There exactly we are actually going wrong. We are going absolutely wrong in terms of how we are eating the fruits because the fiber is gone. ऐसे ही चावल और क्या बोलते हैं wheat से fiber तो ऐसे ही वो refining process से सब कुछ जा चुका है. Okay, the last part of the story. I'm so sorry for taking a long time. What is the role of meal replacers? So we talked about when we are talking about a medical nutrition therapy. You design, you calculate the calories. फिर उस calculate calories 2000 कैलोरी हो गया तो 50% carbohydrates ऊपर नहीं जाना है, इतना fat देना है, इतना protein देना. That's how one designs the MNT. Is there a role of a meal replacement? What is meal replacement? Meal replacement means कि breakfast का time नहीं है, and the next time हम अचानक से lunch के ऊपर कोई कूद रहा है. We are talking about somebody who is like an active executive, doesn't have time for a breakfast, suddenly moves out, and lunch brunch type से होगा, and there's a spiking of a blood sugar. It happens, ma'am. So one of an example where you can intelligently and clinically use that meal replacement is for these patient profiles. अच्छा breakfast नहीं कर रहे हो तो एक meal replacer ले लो. What is a meal replacer? Maybe you can say traditionally at least एक fruit तो खा करके निकलो. So that's a meal replacer. It at least has some calories. It at least has some fiber and get into it. Or otherwise, it is this day-to-day bhagadori wala jeevan, maybe more fit for Delhi and Mumbai, is that some designed a nutritional supplement which can be taken in a glass of water. Again, with the pure conflict of interest, because we are here with Volix, Teliac and Prohance. To give you an example of Prohance, Prohance has also been designed with some polysaccharides. It has some fiber. It has some reasonable, this proportion of a MUFA and a PUFA, and it has a soluble fiber. So it has also the energy. I mean, one can get into all those details later on. But is it really important, even from what do our guidelines and association body says? So the fact is that weight loss is important, and even for weight loss, a meal replacement can be used. How the weight loss from a lifestyle perspective can be done is that maintain an optimal weight. How? By avoiding some saturated and trans fat. And one of the things is here as a meal replacement, which is coming up gradually. And this is because one is talking about an MNT. See, I cannot give you this calculation how one has to do it, but just imagine a 200 kilocalories as a glass जिसमें हम powder dissolve करके दे रहे हैं, जिसमें इतना protein, इतना ये सब fat मिल रहा है. It is a kind of a meal replacement. So, is meal replacement actually advocated, or is it like हम लोग बहुत fat तरीके से हम लोग बात कर रहे हैं, and it's kind of a professional style possibly? It is not. There's quite an evidence from a meal replacement perspective from a lot of professional organization which has come that a meal can be replaced either partly or completely. So let us imagine कि एक को 600 kilocalories का lunch जरूरत है. So you can do it kind of just at 200 kilocalories. That means कि आपने 400 हटा दिया. So let's imagine कि एक glass जो हमने dissolve किया 4 चम्मच of any XYZ nutritional supplement. And that is giving you 200 or 250 calories and just a lunch. So there is no lunch at all, just that thing as a nutritional supplement. Why we are talking about as a nutritional supplement or a nutraceutical? Because it contains some energy, that is the kilocalories, it contains some protein, it contains some fat, and it contains some fiber. So that is replacing a meal, right? Water does not replace a meal. हम कई बार बोलते हैं हमने soup पी लिया. Soup does not replace a meal. Where is the protein and the carbohydrate or a fiber? A meal contains of all those things. So I hope I'm driving that message. When we are talking about a meal replacement, it will replace the components of the meal and not just say कि डॉक्टर साहब हम तो सूप पीते हैं, सब कुछ ठीक ठाक चल रहा है, कुछ नहीं हो रहा वेट के बाद. That's not a meal replacement. So a lot of professional organizations have actually promoted and said that yes, a meal replacement is an important part of a medical nutrition therapy. So there's a lot of organizations. And how to use it, you can use it partly or completely. Supposedly there is a very low calorie diet when one is trying to attempt for reversal of type 2 diabetes mellitus. Not getting into the topic, one can even use a meal replacement strategy as well. When there is, as I told you, if we design it 2000 calories चाहिए but weight loss के लिए 500 हटाना है, maybe you can actually use a meal replacement by taking off half of the lunch or not taking out completely the lunch. Okay, is there a data to show that? Okay, so this is a kind of a look ahead study जहाँ पे control experiments, and this is published pretty well, and more than I guess 5,000 people were there. to find out that whether an intensive medical nutrition therapy, intensive lifestyle measure can help on the occurrence of a coronary artery disease reduction or not, and they try to understand what's happening to the weight. So they actually used a meal replacement as a strategy. So you're replacing with some nutritional supplements or a snack bar, etc. And it was found more the use of the meal replacement, more was the weight loss. So to give you an extent, अगर जिसका 12 meal replacement in a week हुआ है, उसमें ज़्यादा weight loss हुआ है. So meal replacement really has got a medical role out there in context to the medical nutrition therapy. Okay, so I'm not getting into too much of data-centric discussions out here, but the fact is a meal replacement is there to stay and has been actually put into a lot of professional bodies' recommendations. Quickly, back to the summary of medical nutrition therapy. Please let us use the maths and not just say, I said so, he khalo. This needs a registered dietitian. It cannot happen with me and you. We really need to send it to the dietitians. They would have to calculate the calories, they have to divide the calories in context to kahan kya khana. They have to understand there's a micronutrients. And for us, what is important is that in that 2 minutes of a kind of a consultation with the patients, just think that can the meal replacement strategy, can it really help? Whether I do it clinically, my answer is yes. Where I'm actually attempting a weight loss, where I'm trying to reduce the calories, then I go for a kind of a meal replacement strategies. Is it helpful for type 2 diabetes mellitus? Definitely yes. In context to if there is, if you can identify that kind of a nutritional supplement which fulfills all the roles, it has to have the fiber, the carbs, the protein, and the right balance of the fat. This is what I was talking about how to choose a plate in that 1 minute of consultation. Just ensure that the grains are not moving up to more than 30% of the plate. That is quite loosely stated. Okay, can I just take 2 minutes, 3 minutes more?
Sure. Please.
Now this comes with a complete conflict of interest because the medical nutrition therapy is over. I gave you just the gist of an MNT, that how one is supposed to behave as a part of an MNT when you're talking about therapy. If you're talking about just a nutritional counseling, do whatever you want to say. If one is talking about an MNT, the medical nutrition therapy, there is a calculated format, and let's understand this, it needs actually a dietitian to really interact with the patient, but you need to talk about kitna calories or kaise kya hona. Okay, a quick snapshot about Prohance D, because that is what I was asked to do that, and here comes the conflict of interest. It's a promoted slide. Okay, in the powder of the Prohance D, so there's a mixed carbohydrate, there's a reasonable mix of polysaccharides, maltodextrin, as well as disaccharide isomaltulose. The isomaltulose has got a low glycemic index as compared to sucrose. So therefore, the total overall GI, when one takes the shape of those the supplement, is that the GI index is actually low. And the fiber has been taken from a plant-derived fiber. And here is the difference between various other supplements. You have to understand what is a fiber and what is a source. Some would be having an insoluble fiber. This has a soluble fiber, and please understand, not promoting it, and it should be thrown out of this place. What we need to understand is that if something contains a soft fiber, it has got its benefit beyond just causing a kind of a roughage in the stools. So the advantage is more about on a dyslipidemia and actually inhibiting the bile and the cholesterol reabsorption. And the soft fiber sources is gummy fascia. I'm not getting into it. However, the fact is that it has been used historically even as a medicine to help increase the weight loss. In terms of the protein, there are so many supplements which is available as cancer protein powder and consolate. Just see the protein ka sources kya hai of those things. And most of the times, if something contains those whey, casein and soy, as I was telling about from the part of an MNT, the PTSS value of a whey and casein is actually close to 1. Soy is close to 0.9. So these are like kind of high biological value of a protein, which is important. They promote satiety. You need to understand, I'm not getting too deeper into it, you really need to understand is servings kaise dena, even if you have to use a meal replacement. So what is a meal replacement? Maybe 4 scoops lena hai, which is a kind of a close to approximately 50 grams or so, dissolve it in water, and this is what you get. This is the kilocalories and this is the overall protein. So per serve, one can get a 10 grams of protein, which might be close to around 1/6 of the protein estimation for somebody who is 60 kg. This is good. The fats are this kind of fairly proportional in terms of a MOFA and a PUFA. as I was saying, it's completely kind of with the conflict of interest of a pro-hands-free. There's a scientific audience. There are a lot of vitamins into it, and it serves into kind of percentage of a recommended daily allowance. Where do you use these kind of a meal replacement? As I was saying, option. There are also some studies where it has been used as a partial meal replacement 2 times in a day for an overall spiking of a glucose which is on the lower side and which helps in type 2 diabetes mellitus. So, sir, thank you so much. Happy to take up any questions also.
I would now request Dr. S.N. Gupta to please come here and take the CME forward. He was delayed, and I'm sorry because the CME was 82 slide CME. I had to start the CME. Sir, over to you.
Sorry for being late. You've gone through a very exhaustive lecture. May I invite the questions?
Any questions?
Sir, especially when you said that please try to understand there are a lot of contraindications. So, ADA recommends MNT now in a big way. Primary, secondary, tertiary. Primary to prevent diabetes from going from pre-diabetes to diabetic state. Secondary for treating diabetes, and tertiary for...
No controversies here at least. Because when you're talking about an MNT, you have to take care of the A, B, C, the HbA1c,
Right.
the blood pressure and the cholesterol. So this applies to the medical therapy as well as the nutrition therapy in terms of, so no controversies at all out there.
Right. Sir, maybe just a word on the DD, diabetic distress. See, diabetic distress syndrome. Probably you didn't talk about that.
No, I did not.
Yeah.
Are you talking about at least that the person should have a good amount of sleep?
No, sir.
Then
Diabetic distress would be 50% of the diabetic patients have this diabetic distress, which is not in fact a depression. It's the inability to maintain blood sugar, inability to maintain his medication. So probably a counselor is important here.
yeah, so there's a lot of kind of a good diabetes clinics which actually have got a kind of a counseling session
Right.
with all type 1 diabetes mellitus and selectively a lot of type 2 diabetes mellitus, which is ongoing, and it has also been shown that a good psychology counseling has got a positive influence on the HbA1c as well.
Lastly, the role of antioxidants,
Well,
especially at least vitamin B12 in patients who are on metformin.
yeah, again from a medical perspective, again no controversies out there.
Role of antioxidants, sir. I don't think
The named diet. I'm in favor of balanced diet. We have to calculate his caloric requirement and everything, and personalized diet. It should not be. Today also I saw a patient. He was a doctor from Bihar. She was taking no carb diet, and today he came with giddiness and so many other problems. And I just want to know this ketogenic diet or no carb diet. Up to what stage of diabetes they are useful? He was having diabetes for 14 years.
So whether it can really help in a long-standing diabetes, no one just knows about it. Sorry. So as long as within 6 months of onset of diabetes, one can really go for a kind of a very low-calorie diet. But with a long-standing, long duration of diabetes, where we know there's already a beta cell resolve and a beta cell exhaustion which is there, such kind of diet is exceptionally skeptical. So balanced diet is exactly the terminology which was shown in the slide and which is the way to go.
Right. So there was a mention about adding fat to reduce the glycemic index.
Controversial again, but these are like hypotheses because fat can delay the gastric
But
absorption.
I'm in favor of adding alcohol to reduce the glycemic index of food. That also helps. Sir, there was a mention.
how much alcohol?
Well, it can reduce the gluconeogenesis, so that's also right. But this is like transient, it's not a kind of a
Depends on your body surface and your
Depend on what is offered. I mean, if you give him some kind of a diet like, you deprive him of all the pleasures of life, I don't think he can latch on to something like that for a very long time. So it has to be a balance somewhere, and in constant consultation with the consultant and the dietitian and the educators.
So here I would add, sir, extending your point. When I advise diet, I ask the person what are his likings, what he is taking. Instead of giving him new thing, pasta and whatever he doesn't know, I don't advise. And my last question is about rasgulla and jalebi. How much is the glycemic index? Jalebi doesn't have high glycemic index.
They actually do have it because you have actually जो चाशनी से उठा के जलाई they do have that sugar.
बहुत सारी fat है, बहुत सारा protein भी है.
But the glycemic index is actually it's a high GI index. So so it is not 100. Nothing is 100, but they are actually would be classified to a high GI kind of a food because they are more than 70.
Without chasni nahi hai, with chasni hai.
Having large dinners, rather, I don't know whether you call it dinner or supper, but the very large late night meals. So probably a replacement for that would make sense. But do you really think that a complete nutrition can come out of a box? Because I think God gave us teeth to really chew our food. Satiety cannot come simply by something going into your tongue. But satiety also does come by the fact that you have liked the taste, the flavor, the smell, and then chewed on it.
Philosophically, the answer is again absolutely zero debate out there. If anything is coming from nature, that is the best. No questions about it. However, in this day-to-day pace of a life, since I've used it, it's not about a Proansley. I mean, I use that ONS, the kind of an over-the-counter nutritional supplement as well. It comes as a meal replacement closer. At least it's better than just taking a soup and walking on with that kind of a lunch. It's certainly not close to nature at all, so there's no debate around it. Do I use it? My answer is yes. If not a Proansley, I have any other stuff also. So please don't take it as a promotional one. But there is indeed a role of a meal replacement in this fast day-to-day pace of a life, where one is trying to manage, just imagine, breakfast nahi liya, seedha brunch kar rahe hain. So once there is something which goes into it, and for that matter, as I stated, you can even tell the person, please ek apple to kha lo. Sir, utna bhi nahi kar rahe log. So at least in those kind of a circumstances, it can be used. Even in elderly setting, forget about a Proansley or anything, if it is an XYZ supplement which gives you a kind of a protein of close to around 8 to 10 grams, there is some kind of a protein which goes to the elderly in the post-ICU setting, so that is there. So that distinct clinical situations where one can still use it, it's not a big no-no, but no debate, is it better than nature? Certainly not.
But sir, then anyways, after post-ICU settings, we should definitely be looking at more focused diets. Where are we really going to require those particular kind of proteins? Are we going to require this?
Absolutely.
I think that would become very focused.
Yeah, no doubt about it.
This is a very generalized kind of a diet. It is something like, Herbalife.
Sorry, which one?
Something like Herbalife.
I mean, in a way it is. You talk about a Herbalife or a kind of a My Life, or a My Life Pura, or a Proansley, or Abbott's Ensure, or a Protein X. Something has to be there. I'll give you the other part of the spectrum. Forget about type 2 diabetes. जैसे कि ICU में जो discharge होकर के जाते हैं, and when they come back to me after roughly around a month, I actually can visualize the kind of a sarcopenia which they have, and we are forced to say कि यार अंडा भी नहीं खा रहे हो, ये भी प्रोटीन भी नहीं ले रहे हो, अच्छा ठीक है, at least protein shake सुबह दोपहर शाम mix करके पी लो, and that's the only source of protein that is available.
I mean, the only thing that I would want to add to whatever you have asked and what he has added is, we should not add this for reasons for cosmetic uses, etc. In a disease situation with somebody with a background of any kind of a disease, and when you're looking at a reasonable meal replacement, yes. But somebody who wants to do it just for the sake of the BMI has gone to 24.5 or something, not advisable at all. I mean, it's something that one has to understand. It is something who is struggling to either keep up with the caloric intake, or B, who really needs to tone down his calorie intake because his appetite is so much that he cannot do anything else about it.
If you think about the dietitians who are associated with the hospitals, कि जब वो dry tube लेकर के जब जाते हैं और वो बोलते क्या लेना, have you seen the kind of protein diet which they do? मिक्सी में एकदम mix करेंगे, अंडा का वो boil वाला डालेंगे, पनीर डालेंगे, mix करेंगे, and sometimes when I say कि जब वो घर जाकर के जब डालते हैं आंटी में, it's coagulating the rice tube. So then you ask me a question कि और क्या कर सकते हैं? Okay, then I would say कि ठीक है, कोई powder देखो जो अच्छे से dissolve हो सके, उसको at least ले लो. So these are like, it's aiding you, it's helping you, it is certainly not replacing nature, no questions about it.
Dr. Sahu, how much calorie in a particular food?
Yeah, that's again a detailed kind of a discussion, but
I mean, apart from what he has said very correctly, it is always better to involve the homemaker of the house in calculating the diet, because that is something which is going to sustain. And believe you me, every household has a different modality or whatever way you can want to put it, different type of cooking. So it's always better to, basically adjust it accordingly.
Then, and the second thing, like you said, outer layer of the apple is very good, rich in fiber. Many times we remove it due to fear of pesticides. So what is the factual situation?
I really don't have the take on anything around it. The fact is, any fruit, उसका skin में ही fiber है सबसे ज़्यादा. आप अमरूद खाएंगे तो उसका skin में ही fiber होएगा.
Agree.
है ना? So what best in the fear of pesticide? What else to be done? I don't know. Maybe do it my way, in which I tell my diabetic patient, एक काम करो, उस अंकुरित चना रख दो और एप्पल के साथ खा लो. What else can you do? So pesticides हटाने के लिए भी कुछ आ गए हैं आजकल लगता है. You can put it into some water and so
little light on apple cider vinegar.
Sorry, apple cider vinegar. Yeah.
A lot of controversy. Hard about it.
In concept, and you may talk about the science part of it, whatever the part of it. The question is to sustain. It's not a one-day job.
Yeah.
What he has said and what I am trying to say is that it is something which has to be practiced in day out. You can have 6 eggs, kacha, whatever way you format in milk, etc. Put it in a bowl and do. I don't think any one of us out here is willing to take it.
My question is, used in very calorie depleted people, or people who are recuperating for a couple of days after tuberculosis.
Yes. In patients who are admitted, who are on TP and etc. Our bosses, before all these kind of fancy nutritional supplements came in, when we were students in Safdarjung, used to put in ghee, used to put in, anything that you would want, even chocolates, mold and put in, because there was huge amount of nutrition which was going in by those things. I mean, the newer category of doctors, etc., and the newer fancy supplements.
So my point was, it is used for recuperation in people who are coming out of a very debilitating sickness. So once in a while it is given and changed any ekadanta, थोड़ी rum or थोड़ा honey and rum is a solvent sort of thing, जैसे vitamins के syrup में थोड़ी सी.
Is this question specific for Prohance or for everybody? So if for Prohance, since I reviewed the literature before coming here, it is lactose free, it is gluten free. It is lactose free and it is gluten free.
So there is no concern. There is no concern.
Casein actually it has it.
No, but even for we can actually make out the casein. It's a coagulable protein. So क्या बोलते हैं उसको? The lactose intolerance के लिए you need the lactose. So casein is a protein.
Casein.
No. So what I'm trying to make a point is that lactose intolerant people can take it, even if it's got a casein. Casein is actually the protein part of the milk which can be coagulated. उसका extraction process बिल्कुल अलग होता है सर. Lactose is lactose. There's a disaggregate.
Casein doesn't contribute to lactose intolerance.
Lactose intolerance क्यों होता है?
That is because of the casein.
No. Lactose intolerance is always because of the lactase enzyme.
Lactase deficiency.
Cow milk allergy is not because of the lactose. Casein.
Casein is a protein, sir. So lactose intolerance तभी होगा जब lactase पे supposedly किसी का बड़ों में जैसे lactase enzyme कम हो जाते हैं, so there will be lactose intolerance because they are unable to digest the lactose. So disaggregate. इसमें वो lactose free है, sir. This lactose.
Friends, it's 10:30. Dr. Monashis Sahu and our sponsors, Sun Pharma Division. My request to you to consider their nutritional replacement called Prohance D for all your diabetic patients and patients who are in great catabolism. I am sure you would support the sponsors. I would request Dr. M.L. Kalra, who has just returned from a sojourn from US, to honor our Honorable Chairperson Dr. S.N. Gupta sir.
This side, sir.
Big hand for Dr. S.N. Gupta and Dr. M.L. Kalra. So honor him with also present a bouquet of flowers. He did a wonderful job with the 82 slides that he had to contend with, and I am sure the message is very